Thank you, Mr. Chair. This amendment's about just basic fiscal responsibility and prioritizing the people that we represent. In the last 2 years, this legislature has cut $8.5 million from the abortion access funds and is now creating a permanent assessment in the Washington insurance enrollees to fund a new abortion savings program paid for entirely by Washington residents. At the same time, the state spent millions of dollars stockpiling abortion pills through DOC, which we've had a lot of discussion about in here, and it's now being thrown away or given away. I'm really concerned about accountability and accountable spending, and I think that if we're going to compel Washington families and employers to fund this new program, the very least that we should do is guarantee that those dollars will be spent on Washingtonians, not just have it be a standing subsidy for potentially out-of-state persons. So I think this amendment draws a reasonable line, ensuring that Washington taxpayer money will go to Washington residents. So I urge the adoption. This amendment refocuses the underlying policy on real healthcare needs rather than just building an abortion slush fund. By expanding the eligible organizations to include in vitro fertilization and other fertility providers, it would be the state recognizing that for a lot of Washington families, the most pressing reproductive need is actually the ability to even conceive a child. And also that our rural and low-income communities routinely lack access to those sorts of services. This amendment would require that at least half of the money put into this fund would go to providers that would be providing other reproductive services, not just abortion, and it would ensure that the persons that are contributing to this would have a little bit of choice or a little more comfort with how their money is being spent rather than just on controversial abortions. I think this is a good pro-family and pro-equity amendment to keep the program within the frame of reproductive health, but insist that women and couples trying to start families are treated just as worthy as those that are seeking abortions. So I would urge the adoption of this amendment.
Representative Marshall.
Thank you, Mr. Chair. Understand the recent federal changes very, very well. The updated CMS guidance were actually changes to the underlying policy and requiring the $1 assessment. Just because the federal government changed it does not mean that the state is required by any means to backfill that program. I think, again, that this amendment would help refocus the dollars that Washingtonians are putting in to ensure that all Washingtonians with reproductive needs have an ability to get their reproductive needs assessed, even if that means through fertility treatments and in vitro fertilization, both things that are not currently widely available or covered under a lot of the health insurance plans. So if we're going to be extending this to reproductive health, we should do just that. So I urge the adoption.
Representative Marshall.
Thank you, Mr. Chair. Asking for a no on this bill. This is an unprecedented mandate that forces every Washingtonian who buys health insurance to directly underwrite one of the most controversial medical procedures that we have through a dedicated fund with no opt-out for people with profound moral or religious objections. We have never before carved out a single procedure, created a standalone permanent funding stream for it, and then taxed every health plan in the state to keep that stream flowing indefinitely. At the same time, premiums are already skyrocketing, driven largely by over $1 billion in self-inflicted Medicaid cuts that this legislature adopted during this biennium. Yet we're piling on a new cost that every family member and small business will see in their monthly bill, whether they agree with the policy or not. H.R. 1's cuts to abortion providers snapped back on July 4th of this year. So we're simultaneously restoring and expanding state support, and history tells us how the story ends. I mean, in the Dobbs panic, the state rushed to stockpile tens of thousands of abortion pills, spent millions of non-appropriated dollars, and is now dumping the pills when they expire or trying to give them away for free on legislation that's already passed through this committee and the floor. The track record is that we're building on is that waste, overreaction, and moral coercion. I mean, we heard it from one of the ministers who testified in front of this committee that there's significant moral concerns for his congregation and many others that we represent. Today's vote doubles down on all three of those issues by compelling objecting Washingtonians to pay forever for a procedure they cannot in good conscience support and not help with general reproductive health. Please vote no.
Are there additional comments? Representative Marshall.
Thank you, Mr. Chair. There are several assessments and there are several other mandates on all of the insurance programs in the state of Washington, which is why the marketplace has been expanding exponentially. And I've heard a lot of rhetoric about how that is all due to H.R. 1 cuts that largely have not been realized by the state of Washington. It's the $1 billion that has been cut by this legislature in Medicaid funding, along with other mandates on commercial payers with exemptions to PEB-SEB. The reason we have skyrocketing premiums is related to policy decisions that have passed through this body. And this is just going to add to that and continue to drive our rates upwards. And it's frustrating for me to see that these kinds of mandates are happening time and time again for other things, to include vaccines, when really there needs to be some level of choice to opt in or out of these programs. Please vote no.